How prevalent is the incidence of cancer in Hampton Roads? The answer might surprise you. Stay tuned for Health Watch. Hello, I'm Terrence Affer Anderson, and this is Health Watch. If you are a regular viewer of Health Watch, and I hope that there's at least one of you out there, you know that as much as I try to avoid giving numbers, statistics, sometimes it's just absolutely important to do so. This is one of those times. When it comes to the incidence of cancer in Hampton Roads, you should know what we are facing. Check this out. In its 2012 report, Cancer in Virginia, the Virginia Comprehensive Cancer Program reported that per 100,000 residents in the city of Virginia Beach, 439.8 people were diagnosed with some form of cancer. That's a ranking of 28th among the state's 35 health districts. But the numbers began to decline from there, and you'll see that at some point we're talking about a pretty precipitous decline. The Western Tidewater Health District, which includes Suffolk, Isle of Wight, Franklin, and Southampton County, reports that 406.6 people out of 100,000 were diagnosed with some form of cancer in 2012, a ranking of 22nd in the state. The Virginia Peninsula Health District comes in at 19th in the state, reporting numbers of 463.4 people per 100,000. Next up is the city of Chesapeake, with a ranking of 12th place, reporting 473.1 per 100,000 people. The city of Norfolk comes in at 11th place, with 473.5 people per 100,000 diagnosed with some form of cancer. The city of Portsmouth ranks 9th amongst Virginia health districts, reporting cancer diagnosis for every 100,000 residents. Portsmouth reports 478.3 per 100,000 people were diagnosed. Lastly, the Metropolitan Hampton Roads Health District that follows only Chesterfield and Crater, coming in at a startling 3rd place with 513.9 people per 100,000 residents diagnosed with some form of cancer, is the city of Hampton. So, how prevalent is the incidence of cancer in Hampton Roads? It is certainly something worth your attention. And on this issue of Health Watch, we're going to explore that topic with a pair of seasoned experts who will paint a pretty compelling portrait of what is going on in our community. It gives me great pleasure to introduce you to one of my personal heroes, a woman who enlisted me as a warrior in this cancer battle long before I was ever diagnosed myself. Her name is Freda Bryan, Associate Director of the American Cancer Society, South Atlantic Division, Community Health Advisors Initiative. Another community servant of heroic proportions that I am very pleased to introduce is Avanti Allen Benson, Community Health Advisor Manager, American Cancer Society, South Atlantic Division. Mouthful, right?
Yes.
a lot of statistics, and again, it's just so very important that we give these numbers. And I want to welcome both of you to Health Watch.
Thank you.
Thank you for inviting us. It's our pleasure to be here.
It's always good to have you on. This is your first time, isn't it?
Yes, it is.
So, what is the mission of the American Cancer Society, Freda?
Well, it is to eliminate cancer. And of course, by doing that, we would be reducing the suffering that people will have from cancer, not just on a local scale, but on a global scale, to fundamentally eliminate cancer through research, through advocacy, through our different initiatives.
And I've seen some reference to the age of the ACS, the American Cancer Society. You're celebrating a particular anniversary this year.
Yes,
what is that?
we are, and thank you for asking. It is our centennial birthday, 100 years.
100
and we are
years.
determined and committed to finish the fight. Ultimately, the mission of American Cancer Society is to create a world of less cancer and more birthdays, because we are the official sponsor of Happy Birthdays.
I really like that title. That's pretty catchy. And you alluded to this earlier in terms of the international reach. What is ACS doing in that regard? How far is this reach?
Well, across the world, it really is. When we talk about the different events that we have, for instance, Relay for Life, we have an international Relay for Life that happens in different countries. Cancer is not something that's specific to the United States of America. It is a global concern, and we are committed and dedicated to again, eliminate cancer as a burden.
You know, I'm sure most people are completely unaware that the Relay for Life is an international event.
Yes.
Yeah, that's pretty significant, having started here.
Yes, we have many countries, and the photos are just exciting to see, because It's in different languages
Yes.
that we
yes.
have, and when you see the community mobilization in that particular country, it is overwhelming, and it's exciting. It's exciting.
Avanti, what kind of cancers does the American Cancer Society deal with?
We deal with all types of cancer, breast cancer, lung cancer, any diagnosis. Anytime you receive a diagnosis with cancer, the American Cancer Society is there as a resource and a support system for the patient, the caregiver, and the family.
Can you give me any more of an idea of the kind of intervention that it provides?
Yes, we provide several different resources, again, for the patient, the caregiver, and the family. We provide transportation through our Road to Recovery program, so the family does not have to worry about how will that patient or family member get to an appointment. We have volunteers that will take the patient to the appointment, to treatment. We have Reach to Recovery, where we have ladies who are diagnosed with breast cancer, and they're matched with someone who's been diagnosed with a similar form of cancer. And it makes a difference when they can relate to someone who's already gone down that road.
I see.
Yes, we have a matching project where we can link someone with different resources for treatment, for experimental, well, not really experimental treatment, but the latest and greatest, because we have 46 different Nobel Prize winners that have done cancer research for the American Cancer Society.
Wow.
So when there's something new, we can sort of link our clients with those resources.
46 Nobel Prize
Yes,
winners.
46 Nobel Prize winners.
That's amazing. Now, Frida, I want to ask you something that I don't always ask people in a public forum such as this. And that's your personal experience with cancer. You know, I referred to you earlier as one of my heroes, and I say that with great conviction because of, you know, my own experience with cancer and what I've seen you deal with. And you're a staunch advocate for early detection and so forth. Would you share a little bit about your own personal battle with cancer?
Absolutely, and first let me say thank you for your support. Well, when you say hero, I really don't see myself as a hero, but more of a person that's trying to make her community better. So I was diagnosed at the age of 36 in 2002 with breast cancer. Went through chemo radiation surgeries. I will admit that I respected breast cancer and American Cancer Society from afar because I did not know anyone who had survived any type of cancer. And breast cancer at the age of 36 with no personal history. It was through a self-breast exam.
No family history?
No family history that I knew at that time.
Okay, gotcha.
Did eventually find out that I had ovarian cancer history on my father's side, but that was something that we didn't talk about as a family, which is one of the barriers in our community.
Indeed.
Community is not talking about our medical history. So at that time I was active duty Navy, and again went through all the treatment, was in remission for 5 years, and then had a recurrence in 2007, diagnosed with stage 4 metastatic, means I had spread to other areas, and currently under treatment now, and we're managing. We're in the management stages, but I have, like you said, been an advocate since my own diagnosis because it has just, excuse me,
Certainly.
been that important to me. Not just because I didn't know anybody who had survived, but as an African American woman, we didn't see the face of breast cancer, nor did we see the face of survivorship as much.
You know, I'm just going to share this, but I know that you reworked your schedule, treatment schedule to a modest degree so that you can accommodate us for this interview today. Again, that is an example of the kind of heroic effort that you bring to your advocacy, and I truly appreciate that. I wanted to also speak on one other thing. You said you were diagnosed at age 36.
Yes.
What is the age that they recommend that women get mammograms?
Well, American Cancer Society guidelines is the age of 40 that a woman should start getting mammograms. Now, I'll refer back to knowing your family medical history. If you do have direct history, then you need to have that knowledgeable conversation with your physician and find out if there should be earlier testing. We do promote breast health, so that is your annual mammogram, that is your clinical breast exam, and also knowing your breast health. Really knowing and be able to identify any changes that might be going on with your breast and be able to have that conversation with your doctor. But the conversation is going to have to start with your family. The more we know about our family medical history, then the better the conversation that we'll have with that doctor. And at that time, there are decisions that probably would need to be made. And then you empower the patient, and you empower yourself by knowing that information.
Knowing your family history is critically important, particularly when it comes to early detection.
It is.
Now, you have a career at the American Cancer Society, fed to some degree by your own experience. What can you tell us about the different positions that you've held there? Presently, you're the Associate Director for Community Health Advisors. But what else have you done there, and what do you find most gratifying about your work?
Well, I started out as a patient with ACS because when I was diagnosed, I was referred by my case manager to the Reach to Recovery program that we had. So I did have a mentor, Wendy, who came and talked to me. I utilized the Look Good, Feel Better, and let me reiterate that all of our services for the patients are free.
You should say that again.
Yes, all the services that we offer to the patients are free.
Because I know that particularly in the African American community, the cost of medical care sometimes proves a barrier. So frequently proves a barrier.
Yes.
So your services are free.
Our services are free to the patient. Again, going back to we want to eliminate cancer, but reduce the suffering, if you would, for the patient, the family member, and the caregiver. And if that means having a mentor, which helped me tremendously, if it means going through a class called Look Good, Feel Better, which teaches us how to apply makeup, and in my case, literally how to apply my eyebrows because of the loss of hair.
Right.
I know how to cut a t-shirt in half and tie it as a scarf. So I started out as a patient, and then when I became a little bit more knowledgeable on what American Cancer Society is about, I decided to become a volunteer. And I started out, of course, talking about the message of early detection and prevention in our community. And then because of the recurrence in 2007, I lost my flight status as an air traffic controller in the Navy, but I did serve for 22 years. And just how God blessed me that I was able to start as a Making Strides Against Breast Cancer recruitment specialist, and then moved on to the African American Men's Health Forum, which you've been a huge part. Yes, that's where our paths have crossed. And then we received a grant from our very generous donors at Walmart, where 3 cities were chosen to specifically talk to African American women about the importance of breast cancer early detection and prevention. And those cities were Jackson, Mississippi, Minneapolis, Minnesota, and Portsmouth, Virginia, which is how the Community Health Advisor Initiative, which we do have it termed as the Portsmouth Partnership to Beat Breast Cancer initiative, started. So I have been doing that for the last 2 years and have thoroughly enjoyed it, and have been blessed to have Avanti on as part of the team. And this is a team effort, and the community mobilization from our city leadership to our volunteers. We are a volunteer-based organization.
Well, as you well know, I had volunteered as a public relations director for the African American Men's Health Forum for 3 years before I was myself diagnosed with prostate cancer. So I was at a good place for to have received that diagnosis, and it led to again the early detection. Avanti, you are the Community Health Advisor Manager.
Yes.
What does that mean? What do you do?
I manage a group of ladies. I have about 25 volunteers who are linked with ladies in the community who need resources for mammograms. We have different events, health fairs. We go to different churches, the groups that they have at the churches. And the ladies say, yes, I need assistance getting a mammogram. Sometimes they don't have insurance. Sometimes they just don't know what number to call. So we get the ladies' names, they call us, or we have them at the events. And then the names are distributed to the volunteers, who go through 16 hours of training, 2 Saturdays out of the month. And after the training, they're considered certified community health advisors. So once they're trained and they go through everything, they call the ladies and they find out what the barriers are that are preventing them from getting the mammograms. After they get the information, we hope that the ladies call, the clients call, to set up the appointments for their mammograms. After that, we follow up with them. We walk them through the steps. We don't just give them the information. We walk them through from beginning to end Once they receive their results, if they have to go back for a diagnostic exam, we're with them there. Sometimes we have ladies, if they need assistance, they may be afraid. We have volunteers who will go with them and sit with them while they're getting their mammograms. You may need assistance filling out the paperwork, so we have ladies who will go with them for that as well.
So that support is critical for
Yes, it
someone
is.
continuing with
Yes.
everything that they need to do. What do you find most gratifying about your work?
I can actually say I love my job, and this is the first.
That is a
Yes.
verity.
Yes.
Go ahead.
First time I can say that since I graduated from college in 1986.
Really?
I love my job. The ladies that we meet, not just the ladies, the families that we meet that are so appreciative of the services that we're able to render. Sometimes they don't know that there are resources available for free mammograms. They don't realize that they can get primary health care. And to see the ladies, to hear the gratification in their voices is just awesome.
And you partner with other agencies to provide free mammograms throughout the region.
Yes, we do. We partner with Centera Health Systems and Bon Secours. We promote the Caravan with Bon Secours, the free health clinics in the area in both Norfolk and Portsmouth, the Hampton Roads Community Health Center.
So you work with different health systems.
Yes, we do.
Fantastic. Frida, let's say someone has been newly diagnosed with cancer, and they call and do please feel free to chime in on this question, Avanti. And they call the American Cancer Society. What is the process like? What happens after that initial call?
Well, if they decide to call the 800 number, they will be talking to an information specialist that is qualified to ask the right questions, because someone may be calling in to find out about one of the programs that we have, but because of the questions that they're being asked, they may find out about other, again, free services that we offer. And they have the opportunity not to just call in, but there's an opportunity for live chat, or they can send an email. They may want to know what things to eat during treatment. It might be a family member or a caregiver that needs to know how to be a friend to somebody with cancer, because it is not just our diagnosis as the patient, but it's also our circle of friends, our circle of family, maybe coworkers. So it's not just the patient that may need to call in to that number. It might be somebody that is caring from afar or caring from a near. So that information will be sent out to them, whether it's literature or connecting them again with one of the services, giving them a schedule, maybe of one of the services, whether it's a class schedule, and also being able to not leave the conversation without hope. That is one thing that is one of our main words, is we provide hope. They may just want to find out information of events that are going on in the area because they're not closely located with that person, but they want to come out, whether it's Relay for Life or Making Strides Against Breast Cancer, to show support to their loved one.
Anything you want to add to that, Avanti?
Yes, and they can also come to our local office. For instance, Saturday we were having a training session. We're normally closed, but there happened to be someone knocking on the door, and it was a young lady looking for resources. She'd been recently diagnosed, and she wanted to know what was available. We were able to give her information in regards to the different programs. As a matter of fact, her family signed up for the Making Strides Walk as a result of coming to the local office.
That kind of support in my own walk with cancer, that kind of support is very, very important. I was able to thrive despite my diagnosis because of that kind of support. Now, both of you have made references to different events, and you have a couple of things at least coming up soon. Can you tell us about those things, either one of you? Frida?
Yes, Making Strides Against Breast Cancer, that is our signature breast cancer event for the Hampton Roads area, the south side. It is September 28th at Harbor Park. Registration starts at 8 o'clock. The walk is a 3-mile fun run walk, and it starts at Harbor Park. We go down to Nauticus, and on our way back, there's a $25 registration fee pre, and the day of the walk is $35. Now, these funds are raised to provide the services that we have, and also into research. We are one of the largest funders for research, and we know that that is how we're going to not just find a cure, but also find better treatment. And then our Relay for Life is our signature event to support and represent all cancers. And that is a 24-hour relay, and that is located throughout the cities of Hampton Roads. And then on Newport News side, we do have our Making Strides Against Breast Cancer Walk. They're in their second year. It is October 12th at the Mariners Museum. And I will say that on their first year, they were recognized as the most money raised in a first year Making Strides Against Breast Cancer Walk, with raising over $125,000. So we're so appreciative to all of the Hampton Roads community for coming out. Show your support of somebody that you're honoring, or someone that maybe has passed on to cancer, and celebrate their life, celebrate their memory. Bring your friends, your coworkers, your families. Unfortunately, no dogs are available, no pets are available, but those are our signature events that we have here. And there are other events that particular other team captains may be having. So all the information is on our website or on our Facebook site. And again, if they were to call that 800 number, they would find out about local events all throughout the country and the world.
Now, we don't have those dates up on our screen right now, so if you would please repeat those dates. We're going to give some contact information at the end of the show, but if you could repeat those dates for me. I know that you mentioned in Newport News it's October the 12th, and that's, go right ahead, I'm sorry.
I apologize.
No.
October 12th,
Okay.
Newport News Mariners Museum.
Okay.
September 28th, we're kicking off Breast Cancer Awareness Month at Harbor Park in Norfolk.
Okay. All right. And the number that they can call, again, we're going to give that at the end of the show, but the number, what number can they call?
Area code 757-493-7940.
Okay. Avanti, if someone wants to volunteer for the American Cancer Society, what do they do?
They can give us a call at 757-493-4970. Or they can give me a call if they'd like to become a community health advisor, and my number is 757-493-7969. With the volunteers, there's so many different things that you can do. We have some people who just want to come and do administrative work, or if you'd like to volunteer for one of the major events, we'll be more than happy to have you.
Okay, and that number again is
493-7940.
Okay. All right, let's see, and we'll get back to my questions here. Let's say if someone is newly diagnosed with cancer. I asked you that question already. I want to make sure I cover all my questions here, and I generally don't do this. Before we close, what I want to do, I want to get down to the nuts and bolts of cancer disparities. And in 2008, the American Cancer Society reported the following disparities, and this information will appear on the screen. African Americans are more likely to develop and die from cancer than any other racial or ethnic population. African Americans are more likely to be diagnosed at a later stage of cancer than whites. African Americans are less likely than whites to survive 5 years after diagnosis with most form of cancer at any stage of diagnosis. Despite its preventable nature, colon cancer continues to kill a disproportionate number of African Americans each year. Colorectal cancer incidence rates among African American men and women are about 17% higher than in white men and women. African American women have a lower incidence rate of breast cancer than white women, but Black women are more likely to die of breast cancer than white women. And I personally know, of course, that the incidence of prostate cancer in African American men is at least 2.5 times higher than that of white men. So the issue of prostate cancer deaths is because in the disproportionate incidence in the African American community, this can be directly related to early detection and being informed. Any comments on that?
When you talk about disparities, to put it in a nutshell, it is the differences that should not exist.
Indeed.
Because we really could have a whole show on disparities itself. So
that's going to be my next show.
Okay, wonderful,
Yes.
wonderful. So when we look at specifically prostate cancer and breast cancer and why is it affecting our community as much, then yes, you're absolutely right that it is linked to earlier detection and prevention. It also, when we look at what are the contributing factors, it could be the barriers that we have as a community, and I'll refer to what we have mentioned earlier about talking with your family about the medical history, but also making the decision on the type of treatment. So the time of diagnosis to the time of treatment, whether or not that patient is comfortable with the regimen of treatment that is offered. It is a known fact that, for instance, breast cancer in African American women do have a tendency to be more aggressive, which is a little bit harder to treat. So yes, when you talk disparity issues, early detection and then also the prevention aspect plays a huge role.
Well, I want to make sure before we close that we give you contact information. If you could please give us some contact information for the American Cancer Society, Southampton Mills.
Okay, well, the 800 number, of course, which anybody can access 24 hours, 7 days a week, is 1-800-ACS-2345. And that's 1-800-227-2345. And that number is available 24 hours a day, 7 days a week.
And the local number is 757-493-7940. And the website address?
www.cancer.org.
Ladies, I want to thank you both so very much for coming on to the show. And you are a hero. Not just a hero, as are you, but you're both warriors. You know, you have a 22-year history with the military, so you know how to be a warrior. And
Go Navy,
yeah, how
yes.
about it? And you've drafted a real warrior here. Ladies, thank
you.
you so very much for joining us on this edition of Health Watch and talking about cancer in the community.
Well, thank you for
Thank you
having
for
us.
having us.
And we want to thank you, of course, for joining us today. Remember, you can watch previous editions of Health Watch online at www.norfolk.gov/HealthWatch. If you'd like to drop me a line, you can email me at terrence.affer-anderson@vdh.virginia.gov. Please also feel free to give me a call at 757-683-8836. Again, that's 757-683-8836. For the Norfolk Department of Public Health, I'm Terrence Affer-Anderson, and this has been Health Watch.